My name is Joshua Marcus. I'm a board-certified neurosurgeon here at Elite Brain and Spine of Connecticut. My specialties include minimally invasive spine surgery of the lumbar and cervical spines, as well as blood vessel disorders such as brain aneurysms and stroke. TOP stands for Total Posterior System, where rather than a fusion, we can preserve that mobility and not impart any additional stress to the other levels of the spine. And we are really the only center around performing this procedure, which is new and exciting for our patients. When we decompress the spinal canal in patients who have spinal stenosis, the joints and the ligament in the back part of the spinal canal have been taken away. So once we remove the back parts of the spine, traditionally, there's not enough joint and ligament and support for the spine to hold itself together. The traditional approach is to fuse those bones together, typically involves screws and some type of hardware. What that does is makes those bones rigid, right? It enables them to grow into one solid bone, which is often a very successful operation. What it does to the other levels, though, is it imparts some stress. If you take one part of the assembly line away, the other levels are working harder. And rather than fuse those bones, TOPS will replace those, and it'll preserve motion in all dimensions. So patients' flexion, extension, side to side bending, even rotation is preserved. And that takes away the stress on the additional levels. I'm often looking for newer and less invasive technologies to bring to my patients. And so when opportunities arise or we think there's new and exciting technology available, I really want to be one of the first people to explore it. And sometimes it's not right for our patients, and oftentimes it brings them something new and less invasive. And TOPS in particular had a really exciting FDA study over several years that looked very promising when compared to a traditional lumbar fusion. Again, TOPS is not for everybody, but there are certainly patients who are good candidates. And so when we saw that become available, I actually flew out to California for a course to get trained, to learn more about it. We brought that technology back to Connecticut. We did the first procedure in Connecticut in September of last year, and we've continued to be the only center in Connecticut performing this procedure. So far, we've had some phenomenal successes with patients, and avoiding a lumbar fusion and getting patients back to an active lifestyle has been a #1 priority of ours. Once again, I'm Dr. Joshua Marcus. If you or a loved one are experiencing any of the symptoms we spoke about, please feel free to reach out to Elite Brain and Spine. We are happy to help.